everyone, my name is Garcia, a second-year nursing student from Section Wiedenbach. So for today's video, I'm going to do a demonstration of the bag technique. Bag technique is a tool making use of community health bag, which student nurse use during his or her home visit in the community, can perform a procedure or nursing care with ease and deftness, saving time and effort, which results to a rendering effective nursing care. Community health bag is indispensable, essential for community health nurse, which she has to carry along with her as she goes out for a home visit in the community. And it is composed of a necessary articles which may be used in giving effective nursing care. So the purpose of bag technique is to render effective nursing care during a home visit in the community. Special considerations in doing bag technique: first, the bag should contain all necessary articles, supplies, and equipment that may be used in answering emergency needs. Second is, the bag and its contents should be cleaned or cleansed as often as possible. And the supply should be replaced and ready to use at any time. So next, the bag used for communicable disease case should be cleansed and disinfected before keeping and reusing it. Fourth is, the bag and its contents should be well protected from contact with any articles from the patient's home, considering that our bag and the contents of our bag are cleansed and sterile, while the contents or articles of our patients are dirty and contaminated. So fifth is, hand washing is done as frequently as the situation calls for, since it helps minimize avoid contamination of the bag and its content. So first step, upon arriving at the patient's home after a short interaction, we have to place our patient bag on a flat surface or on a table in line with a paper lining. So the clean side out, wherein the clean side should touching the bag and the folded part should be touching the table. And we have to, after putting a paper lining, we have to place our bag above it, and the strap should be inserted beneath the bag in order to prevent contamination and its content, considering that our bag is clean and sterile. So next step, if the faucet is available, we have to ask for a glass of water, and if the faucet is not available, we will ask for a basin of water and a glass of water. And if we have them, we have to place it outside the work area in order to prevent our work area from getting wet. And that water should be used for hand washing and for the cleaning of the equipment such as the thermometer and etc. After that, we have to open our bag and we will get our plastic lining, wherein touching in contact with our paper lining. So the clean side in and the folded part out. So this is our folded part out, clean side in. Clean side in, touching with the paper lining in order to provide a non-contaminated work area. So next, we have to take out our towel, soap, dish soap, and also our apron. And we have to leave the plastic wrappers on the bag. So we have to place it on one corner of the table, wherein confines in the plastic lining, and should not touching the paper lining. So this is our apron. We have to get this from this wrapper and put this wrapper back to the bag. So after that, this one is in order for us to prepare for hand washing. process technique. And this towel should be used by drying your hands in order to prevent contamination. Is to put on our apron. So right side out and the wrong side in. With the crease touching the body and sliding the head into the neck strap. And neatly tie the strap at the back. And this apron are used to protect the uniform of the nurse and also to provide an aesthetic appearance. After that, we have to put out the things needed for the case or procedure and put them in at one place or one corner of the work area to make them readily accessible. So we have here a betadine solution. Next, a isopropyl 70% alcohol, a sterile gloves, cotton balls, 4x4 sterile gauze pad. We have here a bandage scissor, a plaster, and cotton applicator. So next step is we have to place our plastic and paper waste receptacle outside the work area in order to prevent our work area from getting possible contamination. So assuming that this is our outside work area. Is we have to close our bag in order to prevent the contents of our bag from possible contamination. And the next step is we have to proceed to our specific nursing care or treatment that is needed by our clients. lining. So the clean side out and the folded part inward. So since this is a folded part, the clean side out are the one who are touching the paper lining. And you have to place it in the bag, and after that, you have to close the bag in order to prevent the bag from and its contents from contamination. So next up, we have to get the bag from the table. Get the bag from the table and fold the paper lining, and the side which is in contact the body should be folded inward. So insert it between the flaps and the cover of the bag. So the side which is in contact with the table is considered as contaminated. So after that, the next step is you have to make a post-visit conference on matters relevant on healthcare. And we have to record significant findings and data to be used as references for our future visits. So last step is you have to make an appointment for a next visit, taking note of the right time, right date, and the right place needed for follow-up care. So the evaluation, we have to all the relevant findings about the client and the environmental factors affecting the client's health, and also the nurse-patient relationship, and if report was established and the nursing care, treatment, or procedure are done. So that's all. That's all the steps and the coverage of